Dr. Walls, what is the mechanism of this Wahls protocol that is shifting the MS? Obviously, some people have no lesion in the beginning. Some people start with one or two, and then increases to more lesions, and then the spinal cord lesions and all that. So, how does Wahls protocol shift these disease structures into repair mode?
You know, we understand that the microglia, these are the immune cells in the brain that are responsible for monitoring the environment, killing pathogens, wiping up debris, and they shape and prune the connections between brain cells and shape and repair the myelin. We know that those microglia will become more agitated, inflamed, destructive if the innate immune system is activated. And we're beginning to realize the innate immune system is either calm or activated based on our modifiable lifestyle factors. So in terms of diet, you have a diet high in sugar, processed foods, a lot of what we call ultra processed foods with emulsifiers, food additives, stabilizers, etc. Do we have poor sleep? Are we inactive? Are we smoking? Having a lot of exposure to air pollution, water pollution, poor indoor air quality? All of those things will accelerate and amplify activity of the innate immune system. So there's more inflammation in my bloodstream. So I'm going to have more achiness, more pain, more fatigue, more inflammation in my brain. I'll have more enhancing lesions, more relapses. I'll be more likely to have more pain, more sensory problems, more motor problems, more relapses. The disease-modifying treatments can block the development of new enhancing lesions, but they don't completely quiet the innate immune system. So you still have anxiety, depression, fatigue, pain, and brain fog. Addressing the self-care routines, helping calm the innate immune system, helping calm the inflammation in your bloodstream, you have less pain, the fatigue is less severe, and you have greater mental clarity. And then the immune cells in the brain are less reactive. So I don't want people to think that I'm advocating this as a replacement for DMTs. That you're gonna have to talk to your personal medical team about how that fits for your care. This is an adjunct, so you have the best possible outcome.
Dr. Walls, I can attest in my firsthand in my own experience with Wahls protocol, with your protocol. I used to get a lot of migraine headaches and dizziness very frequently. After getting familiar with your studies, finally, and then read your book, I got the training from you, and I eliminated the triggering foods, that the ones that trigger those symptoms in me. And I, amazingly, less than a month, I noticed the frequency and intensity of those headaches are getting less and less and less, to the point that I almost stopped. I mean, yes, if I go to Los Angeles traffic and, bad pollution, I may get headache, but those, I know from external circumstances, not inside of my body. So I believe that ultimately, what is in our plate, what we are doing to our body is the decision maker as far as the health and well-being. We cannot expect to have wrong foods and wrong water and stress, not sleep properly and all that, and have a healthy and optimize our health at all. So this really amazing how these factors can change.
And the more of these modifiable lifestyle factors that we can nudge towards away from disease promoting choices to more health promoting choices, nudge these choices bit by bit towards more health promotion, I think you'll find improvement. And so I've learned to carve out of my day a couple hours in the morning for my self-care routines. So I get up at 5:30, do my morning meditation, do my morning workout, take a sauna and a cold shower. And of course, depending on my day, I can spend 2 hours doing that. Some days I have to cut it down to just 15 minutes because my day is so jammed packed. But my wife Jackie will notice that I've let my schedule get a little bit too full. I'm not doing my self-care routines as much, and my face paint is turned on. She goes, honey, I see you've been scheduling some 8 a.m. meetings. You really should not do that before 9 a.m. so you have enough time to do your self-care routines. Because I can occasionally put in an 8 o'clock meeting, but if I start doing it every day of the week, it comes back to bite me. So I've learned that for me, I just do much better if I regularly adhere to my self-care routine.
Dr. Wahls, and also I notice my own experience, when you are in tune with your body, you notice the biosensors talking to you, like telling, no, don't eat this, don't eat that. I mean, you feel it, you know it.
Yeah, it's one of the things that I teach my clinicians when we go through, we talk about the Wahls behavior change model. And in that, there's a key element of teaching people how to recognize biosensor. For many of us with MS, pain is one of those biosensors. I have trigeminal neuralgia, so I can become aware that the sensation in my face is a little bit different. And then it gets some twinges, and then I start getting electrical, really horrific levels of pain. I tell my patients that, so I had 27 years of worsening trigeminal neuralgia. Now, and suffered a lot. Now I have a different relationship with my trigeminal neuralgia. Now, one of gratitude, because now I realize this is my continuous monitor of the level of inflammation that my microglia are experiencing. If my microglia have no inflammation, my face sensation is normal. If my microglia are getting a little reactive, my facial sensation is not normal and begin to have these twinges. And if my microglia are really inflamed, now I have electrical jolts of really horrific levels of pain. So when that is turning on, I sit down and I look back at the previous 24 hours. What was the trigger? Was it food? Was it stress? Was it toxin exposure? Was it a viral infection? Like nearly always I can identify a trigger and like, okay, how can I avoid that trigger in the future? And I also teach my patients, if you have a great week, it's like, this is the most energy I've had. This is the least amount of sensory disturbance that I've had. My hands are working really, really well this week, much better than usual. I'm not stumbling this week, much, much better than usual. Now I want you to look at, so what was I doing this week? And I should do more of that because I had such good health. So if we can get tuned in to that awareness of what our triggers are for a poor health day and what our triggers are for a great health week, you can steadily improve your self-care routine and learn what it is that will be helpful for you.
Wonderful, wonderful, wonderful. So you always have to check in with your body and see how you feel, what you did.
The more we can learn to pay attention, and you can do this by taking making a little journal, and you can make this as detailed as you feel like, or as summarized as you want, brief or expanded, and learn. I want my patients, my tribe, my followers to know that you're the principal investigator of the most important experiment of your life, which is your life, and how all these exposures are contributing to your health or your disease. depending on the choices and exposures that you're encountering.
Absolutely true.